So, good day sir. Today I will recite to you the endocrine glands, their hormones, and their target tissue. First gland, we have the pituitary gland anterior. For the hormone, first we have the growth hormone. For the target tissue, most of the tissue. For the response, it increase gene expression, breakdown of lipid, and release of fatty acids from the cells and increase blood glucose levels. Next, we have the thyroid stimulating hormone. For the target tissue is thyroid gland. For the response, it increased thyroid hormone secretion, which are the thyroxine and triiodothyronine. Next, we have the adrenocorticotropic hormone. For the target tissue, adrenal cortex. For the response, it increased the secretion of glucocorticoids hormones such as cortisol and increased skin pigmentation at high concentration. Next, we have the melanocytes stimulating hormone for the target tissue. Melanocytes in skin. For the response, it increased the melanin production in melanocytes in skin to make the skin darker in color. Next, we have the luteinizing hormone or the interstitial cell stimulating hormone. For the target tissue is ovary and testes. For the response, it promotes ovulation and progesterone production in ovaries in females, and it promotes sperm cell productions and testosterone synthesis in testes in males. So next, we have the follicle stimulating hormone. Target tissue is follicles in females and seminiferous tubules in males. For the response, it promotes follicle maturation and estrogen secretion in females and supports sperm cell productions in males. Next, we have the prolactin. For the target tissue is the ovary and mammary gland and in females and testes in males. For the response, it stimulates milk production and prolongs progesterone secretion following ovulation and during pregnancy in females, and increases sensitivity to luteinizing hormones in males. So next, we have the pituitary gland posterior. For the hormone, antideuteric hormone. For the target tissue, kidneys. For the response, it conserves water and constrict blood vessel. Next, we have the oxytocin. For the target tissue is uterus and mammary glands. For the response, it increases uterine contractions and increase milk letdown from mammary glands. Next, we have the thyroid gland. For the hormone, we have the thyroid hormone or the thyroxine and triiodothyronine. For the target tissue is most cells of the body. For the response, it increase metabolic rates, essential for normal process of growth and maturation. Next, we have the calcitonin. For the target tissue is primarily bone. For the response, it decrease rate of bone breakdown. It prevents large increase of blood calcium levels following a meal. Next, we have the parathyroid gland. For the hormone, parathyroid hormone. For the target tissue is bone and kidney. For the response, it increased rate of bone breakdown by osteoclast, and it increased vitamin D synthesis and essential for maintenance of blood glucose of normal blood glucose levels. Next, we have the adrenal medulla. For the hormone, epinephrine mostly and some norepinephrine. For the target tissue is the heart, blood vessels, liver, and adipocytes. For the response, it increased cardiac output, it increased blood flow from skeletal muscles to heart, and it and release of glucose and amino acids to into blood. In general, it prepares body to the physical activities. Next, we have the adrenal cortex. For the hormones, we have the mineralocorticoids or the aldosterone. For the target tissue, kidneys to a lesser degree, and intestines and sweat glands. For the response, it increased rate of sodium transport, increased rate of potassium excretion, secondarily favor to water retention. Next, we have the glucocorticoids or the cortisol. For the target tissue is most tissue. For the response, it increased lipid and protein breakdown, increase the glucose synthesis in amino acids, and increase blood nutrients levels, and inhibit inflammation and immune response. Next, we have the pancreas for the hormone. First, we have the adrenal androgens for the target tissue, most of the tissue. For the response, it is insignificant in males, and it increases the female sexual drive and growth of pubic and axillary hair. Next, we have the insulin for the target tissue, especially liver, and especially liver, skeletal muscles, and adipose tissue. For the response, it increases the uptake and use of glucose and amino acids. Next, we have the glucagon for the target tissue, primarily liver. For the response, it increases the breakdown of glycogen and release of glucose in the circulatory system. For the reproductive organ, we have the testes for the hormone testosterone. For the target tissue, most of the tissue. For the response, it increases or it aids in sperm cell production, maintenance of functional reproductive organ, secondary sex characteristics, and sexual behavior. Next, we have the ovaries for the hormone estrogen and progesterone. For the target tissue, most of the tissue. For the response, it aids in uterine and mammary gland development and function, external genitalia structure, and secondary sex characteristics, sexual behaviors, and menstrual cycle. So, next we have the uterus, ovaries, and inflamed tissues. For the hormone, prostaglandins. For the target tissue, most of the tissue. For the response, it mediates inflammatory response, increase uterine contractions and ovulations. Next, we have the thymus for the hormone, thymosin. For the target tissue is immune response. For the response, it promotes immune system development and function. And last, we have the pineal glands. For the target tissue, melatonin. For the response, among others, and hypothalamus. For the response, it inhibits secretion of gonadotropin secreting hormone, and thereby inhibiting reproduction.